Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. Here are some of the highlights this hour. Today, Nigeria's president just spent Eid-el-Fitr at home in clear observance of the NCDC protocol to curb the spread of COVID-19. Inspector General of Police warns against religious gathering as Muslims celebrate Eid. And coronavirus cases in Africa surpasses 100,000, figures from the Johns Hopkins University shows. All over the world, Muslims celebrate Eid-el-Fitr by gathering in mosques and praying to Allah for a successful fasting period. But this year, it is a different ball game, as they will not have the privilege of assembling in places of prayer, but have been advised by various authorities to spend the time at home. What this means is that the mosques will be under lock and key, and the celebration will go on in observance of the guidelines of physical and social distancing and the other safety protocols. This evening, we'll be looking at the implication of celebrating Eid without gathering. In the meantime, President Muhammadu Buhari is going to be spending his Eid-el-Fitr at the presidential villa, Abuja. And according to the presidency, this is in line with the directive of the Sultan of Sokoto and President General of the Jamaatul Nasrul Islam, Alhaji Saad Abubakar, spending Eid congregational prayers across the country, as well as the protocol against mass gathering issued by the Presidential Task Force on COVID-19. This year, the president, who has traditionally shared the joyous moment with top government officials, political leaders, community heads, Muslim and Christian religious leaders and children, will not be receiving these homages in a bid to stop the coronavirus from further spreading. And 339 new cases of COVID-19 were recorded in Nigeria last night, another high in a single day, bringing the total confirmed cases in the country to 7,016. The NCDC has also announced that 1,907 patients have been discharged, with a death tally put at 211. The new infections are in 17 states and the Federal Capital Territory, with Lagos having the largest number of 139 cases, followed by Kano and Oyo states with 28 cases each. Now, in the southwest, and that's cases by region, Lagos State is the epicenter with the highest number of cases at 3,093. It has 2,471 number of cases on admission. Next is Kano in the northwest with 875, even though 761 cases are active. And the north central region, the FCT, is the third highest tally with 446. Abuja has discharged 142 patients and 290 cases are active. Now, Borno tops in the northeast, but the cases remain unchanged at 235 cases. It has recorded 24 deaths, third highest after Kano, and it has discharged 89 patients. Edo leads in the south-south with 144 cases. Out of that number, 99 is on admission. And in Enugu, the southeast, leading there, it has not recorded any death, while its total cases remains unchanged at 16. Out of that number, 6 persons have been discharged. Now, the Congress of Health Workers Unions in Kaduna State are threatening a showdown with the state government over the 25% deduction of their April and May salaries as contribution for the management of the coronavirus pandemic in the state. The union is to begin a 7-day warning strike, also demanding for the inclusion of all health workers in the hazard allowance package of the state government, as well as providing them with adequate personal protective equipment across all public hospitals in the state. The Kaduna State NMA chairman, Dr. Stephen Kache, who addressed reporters on behalf of the joint union, describes the 25% deduction of healthcare workers' salary as illegal and says it has reduced the morale of workers on the front line.
Arising from our meeting today, the union noted that apart from the 25% of the salaries of healthcare workers that were deducted in the month of April, another 25% deduction has also been effected in the month of May for all healthcare workers in Kaduna State. This is unacceptable, and is insensitive to the needs of the healthcare workers in Kaduna State. This meeting also noted that there are inadequate personal protective equipment within our hospitals across the state. So our demand now is a refund of the 25% taken in April and that taken in May, and a subsequent stoppage of further deductions. If in the next 48 hours, by 48 hours I mean by Friday 12 noon, the government does not reverse this order and does not meet the demands of the healthcare workers, all the healthcare workers unions in Kaduna have agreed that we're going to proceed on a 7-day warning strike.
In reaction to this, the Kaduna State Commissioner for Health, Dr. Amina Baloni, cautions the union that to declare strike action amidst the COVID-19 pandemic portrays lack of patriotism on their part, asking them to shelve the plan.
We engaged the unions of the joint health workers to have a frank discussion on their demands and also on the government stance. Our appeal is that at this time of this pandemic, it's not the time for us to have rancor, but to pull ranks and to see how we deal with this very new and dangerous disease that we have all found ourselves confronting. Nobody knows where this will start. This will end. And we are hoping that they will listen to the voice of reason and come together so that we confront this pandemic as we should.
Well, for more on curbing the spread of COVID-19, joining us on the program is Professor Adebola Olayinka. She's a clinical microbiologist and also currently coordinates Lassa Fever research for the NCDC and is engaged by the World Health Organization. Thank you for joining us on the program. I must begin by asking that as a researcher into diseases outbreak in Nigeria, what are some of the things that you've noticed with the coronavirus, how it infects one person and then spreads to a community?
Good evening. It's important to mention the fact that coronavirus, well, we all know it's a new virus. The SARS-CoV-2 that's causing COVID-19 is a new virus, and not much is known about it. In fact, I normally joke that this virus is just about 4 months old compared to a lot of the other infectious pathogens that are hundreds or more year old. So one thing about the virus is it's a virus that causes a respiratory illness classically, but apart from the respiratory illness, it also causes what we call constitutional symptoms. And what do I mean by these? These are just general symptoms that are similar to what malaria causes: headache, fever, generalized body aches, weakness, and a loss of appetite, and so on. Now, the virus is such that it attacks primarily the respiratory system. And so what we call the portal of entry, that means the route by which it enters into the body is primarily through the respiratory tract. And regions of the body by which you could get the virus in the respiratory tract are the eyes, the nose, and the mouth. And that accounts for a lot of the preventive messages that is put out, like keeping the distance, because when you don't keep the distance, then you are likely to inhale the virus from somebody who is coughing it out or who is shedding the virus even through speaking. So it's not only people who cough who are able to shed the virus. If someone is positive and the person is talking, that person could actually be bringing out the virus. The other thing about the virus is it's transmitted very easily, it's transmitted very quickly, and it's actually been quicker than most of the other viruses that we've experienced in time past.
I was going to ask...
There are things that are effective against it, okay, and that includes alcohol.
Professor, might just quickly jump in here, and that is to ask about physical distancing, okay, if it's you call it the same as social distancing, and then how much distance now? Is it 1 meter? Is it 2? Is it 3?
Okay, I'll call it physical or spatial distancing, not necessarily social. And that's because there are different social ways by which we interact without actually meeting. So the minimum is 1 meter. But we now say if you have to have contact with somebody who has symptoms, you want to increase that to 2 meters. But the minimum is 1 meter.
Professor, how would you say we're doing in terms of infection and prevention methods in Nigeria?
Could you come again? I didn't get that clearly.
Just to repeat the question,
I didn't get your question.
How would you say we're doing in terms of infection and prevention methods?
What I see is that it looks like a lot of people in the community are not really aware, or they don't understand what needs to be done in terms of prevention. A key thing to help us in terms of prevention of transmission is to keep that distance. And a lot of messages have gone out, but it looks like it hasn't reached really the people at the core of the community. If you go into many communities, yes, people do not go out, but they still mingle beyond their families. And what we expect is that stay within your family as much as possible. And if you need to meet someone outside your family, you need to keep at least that 1 meter distance between yourself and that person. But that message really hasn't gone in. If you go to our markets, you still see people clustering together. You see people, having meeting and keeping that close distance between each other rather than keeping that distance away. And that's a message that we need to understand going forward, especially when even the restrictions are lifted. It doesn't mean we do not keep some of those prevention messages, because they're critical to handling the transmission of the virus.
Need to have more education and indeed more surveillance. But I must ask, in relation to other outbreaks or other infectious diseases, how are we doing? Have the numbers gone up because we're concentrating on COVID-19 or what?
Oh, well, recently we had a very bad outbreak of Lassa Fever. The highest we've had so far in the country. And even though the COVID came up, it was still an outbreak that needed to be addressed. So it's not so much as in we're not focusing on the outbreak, but it's, I think one thing also is Nigeria is used to handling multiple outbreaks at a time. So there was focus on Lassa Fever. The numbers have gone down, which normally happens seasonally in the country, but we still have cases happening. And there are people who are still responding and treating those cases across the country.
All right, we appreciate your time. Professor Adebola Olayinka, thank you for joining us, a clinical microbiologist, currently coordinator Lassa Fever research with the NCDC.
Thank you.
The Inspector General of Police, Mr. Mohammed Adamu, is giving assurances that adequate security will be provided during and after the Eid al-Fitr celebrations. According to him, his command has already put in place proactive and robust anti-crime measures, including the deployment of tactical and intelligence assets to prevent any untoward incidents in the country. He, however, warned citizens that the interstate movement restriction orders, national curfew, the prohibition of mass social gatherings, religious gatherings, is still in force in Lagos, Ogun, Kano State and the FCT. The IGP insists that his men will enforce the orders by the federal government, even as the command is wishing all Muslims in the country peaceful celebrations. We have more on COVID-19 updates from our state when we return. Welcome back. Let's take you to Yenagoa, the Bayelsa State capital, where our correspondent Dobra Timuwood brings us this update.
60. That is the number of persons that have been traced to be in close contact with the latest patient of the coronavirus in Bayelsa State. Now, the patient is a practicing medical doctor, and the COVID-19 task force in Bayelsa State says he's in stable condition. That is putting to rest the rumors making rounds on the Bayelsa State social media space that the patient is dead. Now, the 60 persons, some of them have been placed at this quarantine center at the Bayelsa Medical University. This is done to curb the spread of the virus if they ever come out positive for the virus. Now, the test results for the second coronavirus patient in Bayelsa State. Remember, Bayelsa has 2 active cases. His second test result is yet to be out. The COVID-19 task force in the state says they are still waiting to receive the result, and they are optimistic that the result will be negative. Dobra Timuwood for COVID-19 updates.
Thank you, Dobra. Anesthesiologists have been called to the front lines of the war on COVID-19 for a simple yet vital and dangerous job. They operate ventilators, one of the top weapons in fighting severe cases of this new coronavirus. Joining us for more on this is Dr. Dion Ibeke, an anesthesiologist from Illinois in the United States. Thank you for joining us. Let's begin with what's happening in the U.S. Despite the high number of deaths, some reports are saying that there are signs that the U.S. has avoided the worst-case scenario. What do you think?
Well, I think it's too early to declare victory. We are still very much so in the midst of a pandemic. As of today, the number of cases are 1.6 million, and we have 95,000 deaths, and we are rapidly approaching 100,000 deaths. It is true that major cities like New York, Chicago, New Orleans are seeing a flattening of their curve. But it's also true that in rural America, they're seeing spikes and increases in cases. The other thing is certain demographics are disproportionately affected. Native American communities, Latin Americans, African Americans have been disproportionately affected. So right now is not the time for us to get comfortable. We still have a ways to go.
Doctor, intubation is a key part of what anesthesiologists do, and when a person can no longer survive breathing on their own, you're called on to intubate them. Tell us about the process.
Yeah, so as anesthesiologists, prior to surgery, we are responsible to render a patient unconscious with medication, and those medications also inhibit their ability to breathe. So we, every day, intubate patients for surgery. And because we do it every day, we are also called in emergency situations when patients are in distress. And we're seeing a lot of that in this COVID-19 era. So what is the process? When we are called into the ICU or the emergency room, we assess the patient. We check their hemodynamics, their blood pressure, their heart rate, and that helps us determine the dose of medication that we give. And then we use a device called a laryngoscope, which is similar to a flashlight. There's a blade and there's a light at the end. And that allows us to have direct vision of a patient's airway. And once we see it, we place a breathing tube down the airway, and that attaches to the ventilator to breathe for the patient. As you can imagine, that puts us in close proximity to a patient's airway, exposing us to droplets. So it does make us very high risk for exposure to the virus. But since we're the most skilled at this procedure, we are the ones called to the front lines to do it.
Well, I was going to ask about, what it would require to learn using or operating the ventilator. Would a few weeks cut it? And this is looking at what we're experiencing in Nigeria. We're still having limited equipment. Ventilators are needed. And then we also have a few people who can adequately operate one.
Yeah, so, realistically, it does take training. You go to medical school, you go to residency, and then certain specialties like ICU physicians and anesthesiologists truly are the experts in knowing how to use a ventilator and knowing how to manage patients on the ventilator. However, desperate times calls for desperate measures. And so in the United States, where we were having our healthcare systems overwhelmed in hotspots, we used a tiered approach where we had the ICU physician who's trained in the ICU at the top of the tier. Then anesthesiologists were kind of the next in line, and other physicians. I would say, sure, anyone can operate a ventilator in a few weeks, sure. But it's managing a specific patient and, knowing what specific, dialing the ventilator in specific ways to manage the patient. That's what you need to learn how to do. And physicians as a whole have had some exposure to ICU patients during their medical training. So if you have the ICU physician or the anesthesiologist at the helm leading, and they can easily teach and remind their medical colleagues how to manage the patient on the ventilator. And then the other thing is calling people from other less affected areas to more affected areas to help is another strategy that can be used during a pandemic. And lastly, using technology. I know it can be limited, but wherever you can, using telemedicine, having tele-ICU physicians helping to manage patients is also useful during this time.
All right, we'd like to appreciate your time and continue to stay safe. Dr. Dion Ibeke, anesthesiologist from Illinois, the U.S. Thank you for joining us.
Thank you for having me.
And more than 100,000 confirmed cases of coronavirus have been reported across Africa. So far, there have been 3,101 deaths across the continent from COVID-19, while 39,416 people have recovered. In the meantime, the cases have been rising sharply in many Latin American countries, causing increasing concern to global health authorities.
With more than 20,000 dead, Brazil now has the 6th highest number of deaths in the world from the coronavirus pandemic. And with outbreaks in Mexico, Chile, and Peru, there are now fears that Latin America could be the next epicenter of the pandemic. More than 600,000 cases have been recorded in the region, and more than 30,000 people have died. Over in Asia, India has registered its biggest jump of coronavirus cases in 24 hours, with 6,000 new cases as the country loosens a nationwide lockdown. Here in Africa, 10 cabinet ministers in South Sudan are now confirmed to have contracted the coronavirus. The announcement comes just days after Vice President Riek Machar announced that he had tested positive. International travelers could be fined £1,000 if they fail to self-isolate for 14 days on arrival in the UK. And as the race for a cure continues, UK scientists are to begin testing a treatment it is hoped could counter the effects of COVID-19 in the most seriously ill. The drug involved is known to boost a patient's stock of T cells, immune cells that clear infection from the body.
According to the NCDC, taking ownership and collective responsibility is important as we fight the virus. You can find the latest guide on their website. As the centre continues to work closely with states, you can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria. Also, the World Health Organization has the latest updates on the global response to the COVID-19 strategy. Their website guides the public health response at both national and sub-national levels. You can take a closer look at some of the numbers in real time. And then our website, channelstv.com, has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. Thank you for watching. I'm Millicent Morgan. Stay safe, stay healthy.